We had a class on introduction to GIT, and today we have another lecture on mouth and saliva. So, first of all, I wanted to elaborate some core features of Oracle. So, in Oracle, first we have the live classes in which we will have the one-to-one interaction of the students with the faculty, and live classes at Oracle where the knowledge meets interaction. Then the second is recorded classes. Recorded classes has an advantage that student can anytime, anywhere can have the access of learning through the recorded sessions. Then notes basically provide the ultimate comprehensive books with CBME based question answers, MCQ and fun zone for self-assessment. Then we also provided MCQs for beginners level to expert level for standard multiple choice questions. For 20% discount, you can use my code, that is Dr.Aanchal 20. Then you can also book a slot for personalized counseling session in which you can have a one-to-one counseling session with the counselor. Then we have some packages for basics. 3 months we have 15,000. Then standard it is for 30,000. It will be of 6 months, and the premium one it is of 12 months of 50,000. But the premium one includes a service like pre-recorded classes, live classes, live doubt clarification, one-to-one personalized guidance, notes, quick revision, examination module. So as we have started the series of 8 classes of GIT, so yesterday's class was on introduction of GIT, and today on 17th Feb we have the class over mouth and saliva. And then 19th we have esophagus, on 21st Feb I will take on stomach, 23rd the class will be on liver, 25th it will be on pancreas, and 26th Feb it will be on small intestine, and 28th Feb large intestine. So now proceeding with today's topic, that is mouth and saliva. So going with the introduction, so basically digestive juices that are present in mouth is saliva, which is secreted by salivary glands. So basically there are 4 major types of glands, in which 2 parotid and 2 submandibular, and it also includes some minor glands, for example sublingual and other multiple minor glands are also present. So talking about the mouth, so basically mouth, another name for mouth is oral cavity or buccal cavity. So it is formed by cheeks, lips, palate. It encloses the teeth, tongue and salivary glands. Mouth open anteriorly to the exterior through lips and posteriorly through fauces into the pharynx. And then talking about the processes which is present in the mouth. So first we have mastication. So basically teeth cut and grind the food. Lips and cheeks hold food in the mouth with the help of tongue. Muscles of the mouth along with jaw movements help in chewing the food properly and mixing the food with saliva. So basically in mouth, teeth and tongue both are responsible for mixing of food with the saliva. Now, what is the function of saliva? Here, saliva lubricates and softens the food to facilitate chewing and swallowing. Next, we have taste. So, mouth, as the another process in the mouth is taste. So, as we know, the taste buds which are present on tongue and other structure of mouth help to appreciate and differentiate the different type of taste as sour, sweet, salty. Then saliva also help in appreciation of taste by dissolving the foodstuffs. The another process that occurs in mouth is speech. So the mouth coordinate with larynx and pharynx, lips, tongue during speech. Saliva helps in speech by moistening and lubricating soft part of mouth and lips. Then another process is appearance. So the shape of the mouth along with jaws, lips and teeth together contribute to the appearance of face. Next, we have the expression. So facial expression like smiling and laughing are mostly centered on mouth along with the movement of lips and cheeks. Then breathing, occasionally when nose breathing is inadequate, as in case of running or nasal block, the mouth is also used for the breathing. Some other function in very good detail they have wrote, like first we have the ingestion of food material, the second is the chewing the food and mixing it with the saliva that did by the teeth and tongue, then appreciation of taste of the food, that the taste buds or taste receptors that are present over the tongue that help in the appreciation of taste, then transfer of food bolus to the esophagus by swallowing. So basically whenever the food get mixed with the saliva, so at that time it is known as bolus. Then another function we have, role in speech. So basically with the help of the tongue, the saliva keeps the mouth wet and it also helps in the aiding of speech. Then the social functions such as smiling and other expression are also given by the mouth. Now talking about the saliva. As we know that saliva is defined as the ultrafiltrate of plasma. So that's why the osmolarity of plasma and saliva remains similar, almost equal to 300. It is watery secretion in the mouth produced by salivary glands that aids in the digestion of food. It serves as an aid to swallowing and digestion by moistening and softening the food. Next, we have that salivary glands are made up of two types of cells, basically. We have, whenever we see the cross-section of salivary glands, so we saw the acini cells and duct cells. So the salivary glands are made up of secretory acini and ducts. The basic secretory unit of salivary gland are clusters of cells that are known as acini. There are two types of secretion, basically, the serous one and the mucus one. So as the name suggests, the serous one has some thin secretion, watery secretion, and the mucus will have the thick secretions. Then the acini can either be serous or mucus or a mixture of both serous and mucus. So the mixture is basically known as mixed gland. So in definition wise, if we talk about the serous gland, so basically the serous glands are mainly made up of serous cells. These glands secrete thin and watery saliva. Parotid glands and lingual glands are the serous glands. So whereas if we talk about the mucus, so as we have discussed, the mucus gland produce the very thick secretions. So mucus glands again are made up of mucus cells. These glands secrete thick viscous saliva and high mucin content. Lingual mucus glands, buccal glands and palatal glands belong to these types. And another type we have mixed gland, in which the secretion can be of both type, the watery and mucus. Both the type of secretions can be present. So in mixed gland, they are made up of both serous and mucus cells. Submandibular, sublingual and labial are the examples of mixed gland. So I hope the classification of salivary glands is very well clear to you. So basically, whenever we talk about the major classification, so the salivary glands are classified as serous, mucus or mixed, means type upon the secretion, means which kind of secretions are present in saliva. So now talking about the parotid gland. So parotid gland is basically is the largest of all salivary gland and which is situated at the site of face just below and in front of the ear. So talking about the location. So basically this is the location of parotid gland. And it produces a serous and watery secretion. Then next we have the submaxillary. The another name for submaxillary gland is submandibular gland, which produces a mixed serous and mucus secretion. So if we look at the location, so this is the location of submandibular or submaxillary gland here. So submandibular or submaxillary gland, basically it is located in the submaxillary triangle medial to mandible. Each gland weigh about 8 to 10 grams. Then last we have the sublingual glands which secretes a saliva that is predominantly mucus in character. Talking about this location, so this is the location of sublingual gland. So basically sublingual gland are the smallest salivary glands situated in the mucosa at the floor of the mouth. Each gland weigh about 2 to 3 grams. So I hope the location and the type classification of salivary glands is very well clear to you. Now talking about some minor glands. So in minor gland, basically, we have lingual mucus gland, we have lingual serous gland, buccal gland, labial gland, and palatal gland. So basically, the minor salivary glands are not found in the gingiva and interior part of the hard palate. Von aberrant below the sulci of circumvallate and foliate papillae of the tongue. Glands of Benden present on the ventral tongue. Then we have palatine, glossopalatine glands also. So basically, the palatine glands are found beneath the mucous membrane of the soft palate. And last, we have the another example of minor salivary gland, that is Weber glands. Now, in salivary glands in humans, the saliva is secreted by three pairs of major, larger salivary glands and some smaller or minor salivary glands, as we have discussed. So, again, the major glands has parotid, submaxillary, and sublingual glands. Now, talking about the details, the location about these glands and what types of ducts are present and what is the size of these glands. So basically, first we have parotid gland. The parotid gland are the largest of all salivary glands, which is situated at the side of the face, just below and in front of the ear. Each gland weigh about 20 to 30 gram in adults. Secretion from these glands are impetited in the oral cavity by a duct that is known as Stenson's duct. Then this duct is about 35 mm to 40 mm long and open inside the cheek against the upper second molar tooth. So here we have the location as we have discussed. This is the parotid gland. Then next we have the submaxillary gland or submandibular gland. So it is located in submaxillary triangle medial to mandible. Each gland weigh about 8 to 10 gram. Saliva from these glands is emptied into the oral cavity by Wharton duct. So basically, this is the MCQ question. If we talk about the gland, a duct of the parotid gland, so we have Stenson duct. And if we look at the duct of the submaxillary gland, so we have Wharton duct. Then this is weigh about 40 mm long. The duct opens at the site of ferulum by tongue by means of a small opening that is known as caruncula of sublingualis. Then sublingual gland. So basically the sublingual gland are the smallest salivary glands situated in the mucosa at the floor of the mouth. Each gland weigh about 2 to 3 gram. Saliva from these glands is poured into 5 to 15 small ducts known as duct of Ravinus. These ducts open on small papillae beneath the tongue. One of the duct is larger and it is known as Bartholin duct. So it has basically two duct. It has the duct of Ravinus and another duct, that is Bartholin duct. So this is the location. Here we have Stenson duct and there they have shown the Wharton duct. I hope the location of all the salivary glands is very well clear to the students. Now, minor salivary gland. So in minor, we have lingual mucus gland. So lingual mucus gland are situated in posterior 1/3 of the tongue, just behind circumvallate papillae and at the tip and margins of tongue. Lingual serous gland are located near circumvallate papillae and filiform papillae. Then we have the buccal glands. So basically the buccal glands or molar glands are present between the mucous membrane and buccinator muscles. Then fourth, we have labial glands. So labial glands are situated beneath the mucous membrane and around the orifice of mouth. Then the last, we have the palatal glands are found beneath the mucous membrane of the soft palate. So here we get our major salivary glands. So major salivary glands means it produces the maximum amount of saliva. The contribution of major salivary glands will be maximum and there will be very minimum amount of saliva that will be contributed by the minor salivary glands. So in minor salivary glands, we have lingual mucus gland, lingual serous gland, buccal gland, labial gland, and palatal glands. Then classification of salivary glands. So as we have discussed, the classification is of three types: serous, mucus, and mixed. So basically, the classification, as we have discussed, it will be based on the type of secretion. So first we have serous glands. So serous glands are mainly made up of serous cells. These glands secrete thin and watery saliva. So the secretion that will be contributed by the serous gland, that will be very thin, just like water. Then the example will be parotid and lingual serous glands. Then next we have mucus glands. So mucus glands are mainly made up of mucus cells. These glands secretes thick secretions, viscous saliva, and with high mucin content. So basically the secretion which will be contributed by the mucus gland, that will be very thick. And lingual mucus gland, buccal glands, and palatal glands are the example of mucus glands. Then last we have mixed glands. So as the name suggests, this type of gland will contribute both types of secretion, watery secretion as well as mucus secretion. It means it will contribute thin secretions as well as thick secretions. So mixed glands are made up of both serous and mucus cells. Submandibular, sublingual, and labial glands are the example of mixed glands. Then talking about the nerve supply, so basically there are no direct inhibitory innervations are present. Both parasympathetic and sympathetic impulses are present. So basically in saliva and in basically GIT, the parasympathetic stimulation or impulses are more prevalent. Then parasympathetic impulses may occur in isolation, evoke most of the fluid to be excreted, which causes exocytosis, induce contraction of myoepithelial cells, and this is also caused by the sympathetic too, and it causes the vasodilation. Now, talking about the nerve supply. So basically, in nerve supply, the salivary glands are supplied by both parasympathetic and sympathetic division of autonomic nervous system. So first, as we talk about the parasympathetic fibers, so parasympathetic fibers to submandibular and sublingual glands. In parasympathetic, preganglionic fibers to submandibular and sublingual glands arise from the superior salivatory nucleus, as we can see, superior salivatory nucleus, which is situated in pons. Right? So this is situated in pons, and after taking origin from this nucleus, the preganglionic fibers run through nervous intermediate of Wrisberg, geniculate ganglion, the motor fibers of facial nerve. So this will give origin to facial nerve. Then basically coda tympani branch of facial nerve and lingual branch of trigeminal nerve, and finally reach the submaxillary ganglion. Then post ganglionic fibers arising from this ganglionic supply the submaxillary and sublingual glands. So here we have that parasympathetic nerve moderately dilates blood vessels. Salivation itself directly dilates blood vessels, and also vasodilation effect is caused by kallikrein, that is secreted by activated salivary cells, which act on alpha-2 globulin and causes vasodilation. Then next we have the very important question. So in university exams also, the question over the properties of saliva, composition of saliva, and the question over the function of saliva comes. So talking about the property of saliva, so basically the volume that is secreted per day is approximately 1000 ml to 1500 ml of saliva that is secreted per day, and it is approximately 1 ml per minute, the rate of saliva secretion. Then the reaction, the mixed saliva from all the glands is slightly acidic with pH of about 6.35 to 6.85. Then talking about the specific gravity, to the specific gravity range between 1.002 to 1.012. And the tonicity, basically the saliva is hypotonic to plasma. That's why the osmolarity of plasma and the saliva almost remain same. Now, talking about the composition. So this is a very important chart because the question over the composition of saliva usually comes in the exam. So basically, mixed saliva contain 99.5% water and 0.5% solids, right? And gases also. So as the composition in the table also given, we have 99.5% water and its solids 0.5%. The solids are divided as organic, inorganic, and gases. So the organic components are very important, and the function of all the components are very, very important. That also we're going to discuss in detail in further slides. So in enzymes, first we have Tylene, or another name is amylase. Then next we have maltase. The third enzyme we have lingual lipase. Then lysozymes, phosphatase, carbonic anhydrase, and kallikrein. So all these enzymes are very, very important, and all the enzymes perform a specific function. Like some perform the function for digestion, some perform the function of protection, some provide the antimicrobial activities, some kills the bacteria that is present inside the food. Then next we have other organic substances in which it includes first mucin, then albumin, then proline-rich proteins, then lactoferrin, then IgA, then blood group antigen, free amino acids, and some non-protein nitrogenous substances like urea, uric acid, creatinine, xanthin, and hypoxanthine. So again, all the other organic substances also play a very specific and important role. That's why they are present inside saliva. Then we have inorganic substance in which it includes sodium, calcium, potassium, bicarbonate, bromide, chloride, fluoride, and phosphate. In saliva, some type of gases are also present, that is oxygen, CO2, nitrogen. Normally, glucose is absent in saliva, but it is found in saliva during in the case of diabetes mellitus. So any person who is suffering from diabetes mellitus, so whenever we look for the presence of saliva, so in saliva it may always indicate the presence of glucose. Okay, now as we have already discussed that in saliva, 97 to 99.5% water is present, and the secretion is approximately 1 to 2 liter per day. Now the basal flow is 0.5 to 5 ml per minute. The pH ranges approximately from 5.8 to 7.5, that is hypoosmotic. In healthy non-medicated person, then this unstimulated whole saliva flow rate is 0.3 to 0.5 ml per minute, and the stimulated whole saliva flow rate is range between 1 to 1.5 ml per minute. So as we have discussed, we have inorganic salts which include sodium, potassium, chloride, phosphate, bicarbonate, and some digestive enzymes, for example, salivary amylase, lingual lipase. So as we know that salivary amylase is used for the digestion of starch and lingual lipase used for the digestion of lipids. Then we have some proteins like mucin, lysozyme, defensins, IgA, RNAs, statins, proline-rich protein, histidines, and cysteine. All the proteins has a very specific function, and they are important for us. Now we have some metabolic waste also. For example, urea, uric acid. Some hormones are also there like kallikrein, lactoferrin, somatostatin, glucagon, lactoperoxidase, salivary peroxidase. Then heavy metals are also there like mercury and lead. Then nerve growth factors like renin is there. Then specific blood group like ABO, Lee secretors. Then cellular components include some epithelial cells and WBC. So next we have okay, now talking about the secretion. So the secretion is very, very important. And the question over the mechanism of salivary glands always come in the university exam. So as we can see, and also whenever we saw for the cross section of salivary glands, so we always look for the two types of cells. The first we have acinar cells, and the another cells we have ductal cells. Okay, so here in the diagram, as they have shown, these are the acinar cells, and here these are the duct cells. Now the role of both the cells, acinar as well as the duct cells, both are important because they are equally important, and they give the basically they secrete some type of ions, and the duct cells basically absorb some types of ions. So that's we're going to discuss. So whenever we look for the acinar cells, so as you can see, they have some pores that are known as aquaporin 5, which secretes H2O, right? And these acinar cells secrete Na and Cl. So basically, the main function of the acinar cells to secrete sodium and chloride. Now, next we have the duct cells. So, as we can see in the diagram also, the duct cells always contribute potassium and bicarbonate to the saliva, and the another function of the duct cells to reabsorb Na and Cl, means the function of the duct cells to secrete or to contribute potassium and bicarbonate and to absorb sodium and chloride. So whenever we look for the final composition of saliva, so in final composition of saliva, we will see that there will be presence of maximum potassium and bicarbonate and very minimum sodium and chloride, because the duct cells will reabsorb sodium and chloride, but these duct cells are impermeable to water, so that the water cannot be reabsorbed by these duct cells. So in the first secretory step, the secretion of a primary isotonic fluid will be rich in NaCl, and in secondary secretory step, there will be reabsorption of NaCl and secretion of potassium and bicarbonate. So if we look in the detail, so basically the acinar cells secrete sodium by active process into the acinar lumen, accompanied by sufficient chloride to preserve electrical neutrality. So basically one positive ion is secreted, so to compensate, one negative ion also secrete. So the sodium will always secrete by active process, and chloride is secreted to preserve the neutrality. Then there will be simultaneously passage of water into the acinar lumen, make the primary secretion isotonic, and that will be occur by aquaporin 5. Then look at the duct cells. The salivary duct cells which drain the acini have a rich blood supply. Therefore, they passively reabsorb sodium and chloride and actively transfer some potassium and bicarbonate into the saliva. Now, the duct cells being relatively impermeable to water make the final salivary secretion hypotonic. So basically, the duct cells has a very important contribution, that they will secrete potassium and bicarbonate, and they will reabsorb sodium and chloride. So now this basically occurs at the normal condition, right? But what happens at time when the flow of the saliva is very high, right? So basically whenever we look for the rest state, means the secretion of saliva is very normal, right? So at rest, the saliva contain more potassium and more bicarbonate and very less sodium and chloride, right? So at the time when the saliva secretion is in the normal range. But what happens at that time when we eat food? So at that time, the flow of the saliva will increase, right? So as the salivary flow increase, right? As the salivary flow increase, there will be less time for ions exchange. So basically, whenever we look for the duct cells, so basically what is going on? Ion exchange is going on. The sodium and chloride will absorb, and there will be secretion of potassium and bicarbonate. So at the time when the flow of saliva will be very fast. So at that time, there will be less time for ion exchange in the duct cells. As a result, the saliva become less hypotonic. Means at that time, there will be more sodium and chloride and less amount of potassium and bicarbonate. Right? So I hope the whole mechanism of saliva secretion is very well clear to the students. Let me have a poll. Okay. I'm giving you 30 seconds to answer this question. The largest salivary gland is... Okay. Yes, the answer is right. Parotid. Okay, now let's talk about the effect of stimulation. Okay, so basically, before talking about the effect of stimulation, we should know the control of salivary secretion. Okay, so means how the control of salivary secretions can be done. So basically, saliva production is unique, right? In that it is increased by both parasympathetic as well as sympathetic activity. First, we talk about the stimulation of parasympathetic nerve. So basically, whenever we talk about the parasympathetic in GIT, so basically parasympathetic is always involved for increasing all the secretions and motility inside GIT. So in saliva, in mouth also, parasympathetic stimulation responsible for increasing the secretions inside the mouth. So basically, stimulation of parasympathetic nerves liberates a proteolytic enzyme that is known as kallikrein, okay, from the gland cells, which act on plasma alpha 2 globulins in interstitial fluid to form bradykinin, okay. And as we have discussed, the role of bradykinin to do vasodilation, right? So the effect is mediated through the release of acetylcholine, and in addition, it causes the release of some local hormone, for example, VIP, and this produces the vasodilation of blood vessels of salivary glands, and there will be stimulation of acini cells, and there will be increase in the production of this saliva. So basically, the stimulation of parasympathetic nerve always responsible for increasing the saliva secretion inside the mouth, because the stimulation of parasympathetic nerve always stimulate acini cells to produce and to increase the production of saliva. I hope this concept is very, very clear to the students. Next, we have the stimulation of sympathetic nerve. Now, what happened? So basically, stimulation of sympathetic nerve supply causes secretion of small amount of saliva that is rich in organic constituents and mucus from submandibular and sublingual salivary glands, and because probably sympathetic fibers innervates the serous cells of these glands and have no effect on the parotid gland. So basically, the salivary secretions can be increased either by the taste of food within 20 to 30 seconds or by sight, smell, or thought of food. So basically, as such, the stimulation of sympathetic nerve has no role in increasing the secretion, but they are responsible for decreasing the secretion in the mouth of saliva. I hope the control of salivary secretions are very well clear to the students. Then we have another thing, that basically two types of reflexes are present. Okay, so we will talk about those. The function we will discuss later on. Yes. So first we will look for the regulation of salivary secretion. So basically the salivary secretion is regulated by nervous mechanism through the reflex action. Okay. And in salivary reflexes, basically there are of two types, the unconditioned reflex and a conditioned reflex. Okay. So in unconditioned reflex, it is the inborn reflex that is present since birth. It does not need any previous experience. This reflex induces salivary secretion when any substance is placed in the mouth. It is due to the stimulation of nerve ending in the mucous membrane of or the oral cavity. So basically what happened in unconditioned reflex, there is no necessity that food should be present inside the mouth. So basically this reflex can be initiated whenever we look for the food, we hear for the food, and there is a thought which is there is a thought of food which is present whenever the thought is present inside the brain. In cephalic reflex, we have another type of reflex that is conditioned reflex. So basically, the conditioned reflex is the one that is acquired by the experience, and it needs previous experience also. So basically, there is a necessity of food inside the mouth in unconditioned reflex of cephalic phase. I hope the cephalic phase is very well clear to the students. Next, we have the gastric phase. In the gastric phase, always start after the food enters inside the stomach. And last, we have the intestinal phase. So, as the name suggests, this phase always start whenever the food or the chyme enters inside the intestine. So the mechanism, it is a reflex action, reflex pathway, which will consist of sensory pathway from tongue, touch, taste, touch, temperature, etc. Then superior and inferior salivary center that is present inside brain. Then motor pathway that contains sympathetic stimulation and parasympathetic. So in conditioned reflex, which is developed by habit, as follows reflex from higher cortical center by sight, smell, even bound sound, or by thought. Then in conditioned reflex, the food should present inside mouth or in the esophagus, stomach, or ileum. So I hope the regulation of saliva secretion is very well clear to the students. Now let's talk about the another important topic, that is the function of saliva. Okay, so as we know that saliva is very essential digestive juice. Since it has many functions, its absence leads to many inconveniences too. So about that inconvenience, we will talk in the disorders. So let's talk about the function first. So as the name suggests, lubrication. So means lubrication, whenever the food gets mixed with the saliva, it provides the lubrication so that the facilitation, basically it provides the facilitation of the movement of bolus. So tissue protective coating for hard and soft tissues, oral cavity and esophagus, and food basically never directly touches the epithelial cells of those tissue. Then next we have the binding. Binding mucus binds masticated food into the bolus that slides easily through esophagus without inflicting damage to the mucosa. Then third function we have that it provides or it moists the food. Then next we have dilutes hot and irritant substances. Then next we have reacts with bacterial adhesins. Mucin coated bacteria may be unable to attach to surface bacterial adhesion, thereby blocking them. Some other function also we have, that is appreciation of taste, that already we have discussed. So basically, as we know that taste is a chemical sensation. So basically by its solvent action, saliva dissolve the solid food substances so that the dissolved substances can stimulate the taste buds. The stimulated taste buds recognize the taste. Now another function is the digestive function. So as we know that saliva also contains many digestive enzyme, for example salivary amylase. So basically the salivary amylase is a carbohydrate digesting enzyme. So it acts on cooked or boiled starch and convert it into dextrine and maltose. Another function is of lingual lipase. So as we know that this lingual lipase is another enzyme that is secreted by saliva. So again the lingual lipase is a lipid digesting enzyme. It is secreted from serous gland situated on the posterior aspect of tongue, and the main function of lingual lipase is to digest fats. Then another function of saliva, that it also provide or a very important role in speech. So by moistening and lubricating soft part of mouth and lips, saliva helps in speech. If the mouth become dry, there will be difficulty in pronunciation, right? So these are the very important function that is provided by the saliva. Now look at the disorders. Okay, so first we have hyposalivation. So hyposalivation basically, whenever there is reduction in the secretion of saliva, that condition is known as hyposalivation, and it is of two types, namely temporary hyposalivation and permanent. So in temporary, there will be emotional condition like fear. It could be due to fever, dehydration, and in permanent hyposalivation, it could be due to Bell palsy or congenital absence or hypoplasia of salivary glands. Then next we have hypersalivation. So as the name suggests, in hypersalivation, there will be excessive secretion of saliva. Okay, so that condition is known as hypersalivation. So basically, physiological condition when hypersalivation occur in pregnancy, and hypersalivation in pathological condition, it could be in condition like talism. Then hypersalivation occur in the other condition or like in decay of tooth or neoplasm, in disease of esophagus, stomach, intestine, and during cases like nausea and vomiting also. It also occur due to some neurological disorder like cerebral palsy, mental retardation, cerebral stroke, Parkinson. So these are the condition also which is responsible for this situation. So I hope the disorder of hypersalivation is very well clear to the students. Next, we have xerostomia. So basically, xerostomia means dry mouth. So it is also known as pasties or cotton mouth, and it is due to hyposalivation or absence of salivary secretions. And the reason could be the dehydration or renal failure. The Sron syndrome could be the another reason. In case of frequent radiotherapies, then trauma to salivary glands or their duct. The another reason could be shock. So these are the causes or reason to whenever this condition xerostomia is present inside the patient. So in today's lecture, we have covered the location of salivary glands, the classification of salivary glands, the function of salivary glands, the mechanism, how the secretion of mechanism occurs through the two types of cells, that is acini cells and duct cells. Another thing, we have covered the function of mouth. Then we have covered the composition of saliva. Then we have covered the functions of saliva. Then we have also covered the disorders that are related to saliva. So I hope the lecture is very, very clear to the students. One more question is remaining. Okay. You have 30 seconds for this question. Tongue is attached to the floor of buccal cavity by. Yes. The answer is B. Another question is there. You have another 30 seconds for this question. The duct of Bartholin is linked with. Correct. The answer is A. So thank you, student. If anyone has any question or any doubts, you can ask me. Okay, thank you.